Knock knock. My name's Leticia with South Florida State College. I'm gonna come in, I'm gonna wash my hands, I'm gonna make sure I have all my supplies, and I'm going to make sure I wash my hands. And I'm gonna ask you, he'll have a band on him. Can I see you like your arm like you have a band? And can you give me your name?
Antonio Walker.
And can you give me your date of birth?
July 2nd.
As he's telling me this, I'm making sure that I have, that it's correct on his band. And I ask you, do you know where you are?
Yeah.
Can you give me the address?
908 Pioneer Avenue.
And do you know the president?
Yeah.
And that is?
President Trump.
Yes. As he's telling me this, I'm checking for any lethargy, making sure he's alert and oriented. I'm doing a full assessment to make sure he's not using any accessory muscles whenever he's breathing. I make sure he's not drowsy or anything. And then now I'm gonna check his eyes. Oh, I'm gonna do his blood pressure, his vital signs. I'm going to pretend this is a thermometer. I'm going to do a tympanic thermometer, and let's say it's 98.1. And I'll just put this aside. Do you have any pain today?
No.
So on a pain scale of 0 to 10, your pain is 0?
Yes.
Today we're going to be doing a head-to-toe assessment, if that's okay with you. So I'm doing your vitals now. You have to make sure your feet are uncrossed while doing blood pressure. I'm going to do your vital signs now, and then if it's okay with you, I'm just going to go from head to toe, and then I'll just explain what I'm doing.
Right.
Blood pressure is good. Blood pressure is 126/62 with a pulse of 62. Normal blood pressure is ranging 120/80. Signs and symptoms of high blood pressure would be dizziness, headache, any blurred vision, stuff like that you want to report to your doctor. Now, I am going to do a cranial nerve assessment, if that's okay.
Yes.
Can you sit forward just a little bit, please? I'm assessing cranial nerve number 2. I'm going to be looking at the size and the shape of your eyes. His pupils are about a 3. I am going to assess to make sure that there's no redness, no increased drainage, nothing going on with his eyes. Ask him if you have any problems. You wear glasses. Do you have any problems with the glasses seeing?
No.
And now I'm going to do the reaction to the light. So I'm going to ask you, can you fixate on one thing on the wall? Let me fix this. Can you fixate on one thing on the wall and there you go. And look straight. I'm going to put this light close to you, and what I'm looking for is to make sure that they contract and dilate back. Okay. Will you look at this light? And don't take your eyes off of it. Good. So now I'm going to do eye movement, and I'm going to do, that's cranial number 3, 4, and 6. And what that is can you look up? Can you look down? Can you look to your left? Can you look to your right? Please don't do it ahead. And what I'm making sure is that everything is equal that he's doing, and that the other eye is not, taking more than the other, or that they're not bouncing, that one's doing it correct, or one's doing it properly. Now, the next one is I'm going to check for cranial nerve number 3, and I'm going to ask you, can you raise your eyebrows? And can you frown your eyebrows? Thank you. And then I'm just checking for any abnormalities as he's doing that. And then the next cranial nerves that I'm checking for is for cranial nerve number 7. And what that is can you smile? Can you puff your cheeks? And then I do a facial sensation. You can do it with cotton swabs, you can do it whatever, and you make sure that both of them are the same, that he feels them the same, or you can do one at a time. And then after I do that, I'm going to ask you, can you open your mouth? Put your tongue down. Open your mouth. Ah. No, you're putting your head down. Yeah. You open your mouth, and now you're going to do, I'm making sure that your uvula and your palate is rising. And I'm going to ask you, can you move your tongue? And that's cranial nerve number 12. And then to assess cranial number 11, I'm going to ask you, can you shrug your shoulders for me, please? Thank you. And I'm making sure that that's equal also. Now I'm going to do the grips of the hands. Can you make sure, can you squeeze them? Thank you. And what I'm checking for is equalness as I'm doing that. I was hoping I wasn't standing in front of the camera when I was doing the mouth thing. So if I was in front of the camera, I was asking him to open up his mouth, move his tongue, and then I'd be checking the uvula. I don't know if I was standing in front. So then the next one is that I'm going to check for is I'm going to do a finger rub, and I'm going to ask you, what do you hear? Rubbing. And then, so you ask, do you hear him equally on both sides?
Yes.
Okay. And now I'm going to ask him if he could stand up. I'm gonna move it until we can have more space. And as I'm doing this, back up a little bit, I'm going to check his skin. I'm going to check everything. I'm going to make sure he doesn't have any new lesions. Make sure he doesn't have, if he would be referred to a dermatologist. I would make sure that he's, that I don't find that his temperature is warm and there's not any difference in his legs or his back or anything, because then that would constitute for like PVD for his legs, and stuff like that. So we can go and we can sit back down. Let me see if you can sit forward. Yeah, that's better. Okay. So now I'm going to do circulatory. When I check his skin, I'm also checking for dehydration. I forgot. So how you do that is you pinch you pinch the skin, and if it stays up, then that means dehydration. So then if you do have that, that's something that you want to make sure that you don't have. You want to increase your water intake. Now I'm going to do circulatory, and what I do is I'm going to make sure I'm going to feel and listen for a carotid on each side. I'm going to make sure that the pulse is bounding. I can listen to it. In order to listen for a bruit, I'm going to ask you, can you take a deep breath and hold it? Let it go. Deep breath. Good. And when you're doing that, you're assessing for a bruit. And then I'm going to check all pulses on him as I listen to the carotid and I make sure the carotid's there. So we can go to the radial. Radial. Now I'm going to check the other side. Now I'm going to check his posterior tib, and I think you can see it. Just bring it just a little bit. Tony, you should need to see it on the camera. Right there. Yeah. So posterior tib is right about here. And the other one right about here. Fetal pulses. Back up your butt. And the other one. I'm checking to make sure that all of them are present, because that could also be circulatory issues with anything. As I'm down here, I'm going to be checking for edema, beginning from the knees down, because edema can accumulate. So we press down to make sure that there's no edema. Your most present edema is usually around the ankles, especially for your congestive heart failure patients. And if so, you would teach them to be wearing TED hose at all times during the daytime, and then when they go to sleep, that they need to take it off, that they need to take them off. And the reason for that is it could exacerbate the CHF while they're sleeping. So whenever they get up, they're not going to have that edema. So now I'm going to listen to your heart for 1 full minute. As I'm listening to his heart, I'm making sure that he just has an S1 and an S2 and doesn't have an S3 or an S4, and listening for any murmurs. I would ask him, do you ever feel short of breath, or do you feel like your heart is irregular, like it skips a beat, or you feel tired?
No.
So then now I would listen to, well, yeah, we'll do your heart first. So then we come up to the right. Second intercostal would be his aortic. We would move right over to the second left intercostal, and that would be your pulmonic. Right underneath that, you would have your Erb's point. Right underneath that, you would have your tricuspid, and then over to the side, you would have your mitral valve. When you do that, you are listening once again for your S1 and your S2. You're making sure there's no extra heart sounds or murmurs. Then that's when you would flip this over and you would listen with your bell. You could do that with your carotid also to make sure you don't listen for a bruit. And then you would turn around into your bell, and then you would do the same thing. So we start over with your aortic to your right. You would listen. You come over to your pulmonic. You would do your Erbs right underneath it. Right underneath that is your tricuspid. You would move over to your mitral valve, and you would make sure you don't have any of that. I'm going to go ahead and let me do your abdomen. Let me see how I move this camera over. Can you lean that chair all the way back? Okay, now I'm gonna do his abdomen. When I'm looking at his abdomen first, I'm gonna start off by inspecting the abdomen. I'm gonna make sure that he's not using his accessory muscles or that there's any lumps or any nodules, anything that I need to worry about at this moment. I don't see anything, so my first thing is to inspect his abdomen. After I inspect his abdomen, I'm going to auscultate. The abdomen is broken down into 4 quads. Your right upper, and I'm listening for bowel sounds and making sure there's nothing extra. Making sure he has bowel sounds, and you can listen to that up to 5 minutes. Do you have any issues with constipation? Okay, as I do that, I am going to make sure I can do a light palpation, and I ask you, tell me if you have any pain. Okay, and that is the abdomen. So we can go ahead and sit up, please. So now we're gonna do your respiratory, and let me back this up. Well, no, actually, sit up. Perfect. Okay, with respiratory, the same thing. We're gonna make sure that he's not using his accessory muscles to breathe. And we're gonna start off listening to the lungs. With the elderly, you would listen to the posterior lower lobe first to make sure that they don't get short of breath. And so we'll do here. Deep breath, in, out. Good. And now I'm gonna do his posterior, and let me, or you know what, turn to your side a little bit. The other way, the other way. Yep, so I'm going to listen to his, keep turning. Tony, you want your back towards the camera. Yeah. Okay, take a deep breath. And all the way down. Okay, and you know, let me have you, for respiratory also, I'm gonna listen for some tactile primitives, and I'm gonna have you say 99.
99. 99. 99.
Okay, turn around and face me. Or at least turn around, yeah, so they can.
99. 99. 99.
Okay. Okay, so after I do that, I am going to assess for his bladder. And for that, just sit back. We have, for right here, I'm gonna ask you, do you have any issues urinating?
No.
Any pain while urinating? You have, your bladder distends. When you haven't used the restroom in a while, it distends and you feel it there. It's very important for you to use the restroom when you feel that you have the urge to use the restroom. It is a very sensitive bladder. For your bladder, I'm also gonna do your CVA tenderness. Let's turn on. For the CVA tenderness, what I do is you have this area right here where your kidneys are, your left and your right, and this is how you verify. I'm going to tap it, and then you just let me know if there's any pain, and it's right about here. Do you have any pain? Any pain?
No.
Good. Okay, you can turn around. Now we can do, let me do your reflexes. I'm gonna do your reflexes. Okay. I'm gonna use my stethoscope because I don't have a thing to check his reflexes with. So this is for deep tendon reflexes. I can do your brachial. Let's sit forward. Let's sit forward. And you can just let it hang. And then what I do is I'm gonna tap it. And that's exactly what should happen. And that's just making sure that your reflexes are working correctly. And I'm gonna do the other side. I'm gonna tap it with this. And you've seen the hand movement. Now I'm going to do, you need to sit back. I'm going to do the other reflex, and I'm going to do your knees, your patella. You can also do some other ones, but I'm just gonna do the patella. But your knee needs to hang, yep, okay. And then what you do is you just tell them that to hang it, and then you just tap it lightly, yep. And tap it lightly, good. And so now I'm going to do the motor functions, and which is I can either ask you or I can do it, and it's flex your arm, any pain,
No.
bring it forward, any pain, over to the side, any pain.
No.
Okay, we're gonna do the other one. Up, extend, bring it in, any pain,
No.
good job. And then now we're gonna do the same thing with your legs. Bring it out, bend it, any pain,
No.
bring it out, bend it, any pain. He is not diabetic, but if he was diabetic, we would be asking him if he can take off his socks so that we could be assessing his feet, because if you are diabetic, you need to check your toes on a daily basis. You need to make sure they're not wet. They cannot stay wet. You need to wear open toe shoes at all times. And it just needs to become into a routine that's what you do. We're gonna do strength tests with those same arms. And what I'm doing is just making sure that they're all even. So from here, push up, good. Push down, let's do it with the other one. Push down, push up, good. And then we're gonna do that with your feet. Okay, push, yeah. And push up, good. Up and down, good. And for that, I'm just making sure that he has the same strength in both of them. And so now I'm gonna have him do his, what am I forgetting? I'm gonna have you do your back flexion. So if you could stand up. So this is to make sure that you have flexion in your back and don't have any unevenness. I'm gonna ask you if you could stand up and then, stand up straight. I'm gonna ask you if you could touch your toes. Good. And when you stand back up, touch your hips. And if you could do that one more time for me, please. Good. Now I'm gonna do Romberg, and if you could face the camera. Thank you. And we need you to close your eyes for 30 seconds with your feet together. And what we're assessing is Romberg sign, and we're making sure that he doesn't sway or anything for 30 seconds. While we're up, we can go ahead and do the heel toe walk, and that's heel to toe and walk. And what we're looking for is any swaying when you're doing that. Good job. And turn around and do it back, please. Good job. You can come back, you can sit down, please. We're gonna do the coordination of the hands and fingers. And so if you could sit forward, and I'm gonna ask you if you could do your hands like this. Yep. And then like this, and then do it together. Okay. And then, so now I'm gonna ask you, can you touch each finger with, yeah. Yeah, and now backwards, yeah. And then the other one, please. Thank you so much. And what I'm testing for is coordination. And now I'm gonna ask you, is there anything, any questions or anything that I can answer for you while I'm here with your head to toe assessment?
No.
Are you comfortable?
Yeah.
Okay, I'm gonna make sure that his call light is within reach. I'm also gonna wash my hands. I have a pamphlet in here. I always make sure that we have to have some teaching. My teaching for today is on prostate cancer. How old are you?
44.
Prostate cancer is a cancer that occurs in the prostate. Do you know where your prostate is?
Oh, yes.
Do you know that it's a small walnut-shaped gland, and it produces a seminal fluid that nourishes and transports the sperm? It is most common it's the most common type of cancer in men. Do you know the signs or symptoms of prostate cancer? It would be trouble urinating, decreased force of urine, or blood in the semen, discomfort in the pelvic area. When would you need to see the doctor is when you have any signs or symptoms that worry you. If you have any signs or symptoms, they could always have you screened. The causes, they're not sure what causes prostate cancer, but trying to catch it at an early age is definitely something that we should be doing. Risk factors, your risk of prostate cancer ages as you increase. Black men are at greater risk of prostate cancer than other races, and especially if you've had a family history. Obesity is another risk. Prevention. I would tell you if there's any prevention, it would probably be, and this all comes from the Mayo Clinic, is to eat healthy foods. Instead of, doing supplements, like people think that they should get on vitamins and stuff like that, then they should be eating healthy foods. Try to exercise, try to drink more water, and always try to maintain a healthy weight. I'm going to give you some of the info that I have printed off from the Mayo Clinic. And again, I'm going to make sure that I wash my hands, make sure he's comfortable, put the call light within reach, and have a good day.